Welcome back to episode 13 of the Cutting Deals podcast, brought to you by Wave Global. Use the link in description and TT10 at checkout for 10% off your purchases. And today we got a very special guest. Dr. Khetani is a Canadian board certified head and neck surgeon who completed his medical school at the University of Toronto and then went on to complete a rigorous surgical residency at McMaster University. Now, Dr. Khetani is excited to welcome patients in his new aesthetic practice, Khetani Medical Aesthetics, an extension of his already thriving medical practice. We trust that you will have a very educational, professional, and caring experience at Dr. Khetani, now booking appointments in Burlington.
Yes, sir.
Let's go. Welcome, Justin.
Thank you guys for having me.
Yes, sir. The most handsome doctor ever.
It's a special guest with a special intro.
Yeah, thank you so much. I appreciate everyone for welcoming me to today. This is awesome.
So describe more about like a life of a surgeon to us.
Yeah, man, it's busy. It's busy. You know, like it's seeing patients in your office and then booking those patients for surgery, and then but you know, I've been doing this for 10 years now, and so it kind of gets routine, but it's a super awesome and rewarding job because you get to kind of help people, right? And so it's pretty nice.
So how many surgeries do you do like on a daily basis, basically?
It depends on the type of surgery that you do, right? Like if you do smaller surgeries, when we do take care of kids and put tubes in their ears or take their tonsils out, it's quicker. But when you do bigger surgery, like cancer surgery, it takes a bit longer. On average, you do anywhere between 8 and 10 surgeries a day.
Oh wow,
that's crazy.
a lot. So you remove like cancer tumors and stuff like that
Sometimes.
Oh wow, that's amazing, man.
That sounds stressful.
Yeah.
You know what? I think if you do it over and over again, I think the actual surgery becomes kind of routine. I don't think of it as stressful. I do recognize that I'm pretty lucky to be able to do what I do, so it's pretty awesome.
What's like the school process for you to become a surgeon?
It's long. So
I don't know, man. You look like you're only 25, man. So it looks like you graduated just like yesterday, man.
I get that a lot, man. So I did 5 years of high school, 4 years of undergrad at McMaster, 4 years of medical school at the University of Toronto, 5 years of surgical residency. And then on top of that, because I didn't have enough, I did 1 extra year of fellowship, which is like subspecialization. So I've been in practice since I was like maybe 32, 33.
Oh, no way.
Yeah.
Damn, that's a long time,
that's
bro.
crazy.
Yeah.
What country did you go do your residency?
So I did my residency at McMaster, and then I went to Alberta for a year to do my 1 year fellowship.
Oh, wow. Because all my
fun.
clients who are doctors, they're either going to like the Caribbean or like the UK.
Yeah. No, I'm straight Ontario bred,
Whoa.
Did you want to do your fellowship in Alberta, or was it just like...
You know what? They had one of the special fellowships around. And so, I was like, Alberta's not really the sexiest place to be, right? But like we went out there and had a great experience, totally educational. It was an amazing year.
So growing up, did you know that you wanted to be a surgeon like right away, or?
Yeah, I think I always knew I wanted to do something special. I think early on I knew that I was pretty smart. I was getting good marks and stuff, and then it just seemed like everything kind of felt natural. Like when I got into high school, it just like always getting the kind of the best marks in class kind of thing, and then just felt like a natural progression. Yeah,
that's like very deep.
Yeah.
I was like that until I got into law school. Then I'm like, fuck, I'm not the smartest one anymore.
That's so.
Yeah.
What's the craziest surgery like you've ever done?
Oh man, dude, there's so many surgeries, right? A lot of trauma cases, but as a sinus specialist, I remember one time where a guy came into the office. He was like in his 30s, and he was like, Doc, I got a lot of water coming out of my nose. I'm like, okay, all right. And so I look inside and I see something weird, and then I get a CT scan, and what happened was that I later learned that he was moving some furniture in his home, and he strained so much that he heard a pop, and actually brain fell into his nose.
Oh,
Yeah. So
God.
that clear fluid that he was leaking out of his nose was brain fluid. Yeah, it was so it's pretty
That's
crazy. Pretty
crazy.
crazy. So we took him into surgery and kind of patched it up, and he did awesome.
Wow.
Yeah.
So like, you know, with like social media stuff and all that stuff, like where people getting their faces done
Yeah.
and stuff, like when you walk down the street, like when you look at a person, can you tell that a person got their face done already, or just by looking?
It's trickier nowadays. I think you know, when people think of cosmetic enhancement, you know, they always think of like the bad cases and the really you know, overdone cases, but you know, I think the trick is to be a little bit more natural. So I mean, it really depends. Yeah.
So when I was in high school, I played rugby, right?
Yeah.
And I had this teammate who tackled someone really hard,
Yeah.
and then he just got knocked out.
Yeah.
And then he gets back up. Same thing like the guy that you did work on.
Yeah.
His nose actually started leaking like a yellow fluid.
Yeah.
It looked like mucus almost, but it
Yeah.
was clear.
Oh my goodness.
So what is that?
So I think every case is a little bit different, but yeah, that sounds really scary, actually. Yeah. So I think in that situation, you probably have to get to see a nose specialist, like someone like myself.
Mhm.
And then what we do when we see patients in the office, we have a little kind of telescope. It looks like a piece of spaghetti, really, and we can kind of look inside the nose and see what's up, you know.
How about when you like look into people's ears and stuff, like the ones that's like hasn't cleaned it for like years?
Yeah, that's pretty nasty. Yeah.
So like, do you recommend people using earbuds?
No, hands down, no. I'll tell you, if you look at the Q-tip box,
Yeah, the Q-tip.
you know what
yeah.
it says? It
What?
says, "Do not put in your ear."
Yeah, I've seen that, yeah.
No way.
So how
Yeah,
should we
so-
clean our
This
ears?
this
then?
guy's addicted to
Really?
using Q-tips.
Yo, Luigi,
I heard like after the shower, you're just supposed to use your towel a little bit, and that's it.
That's absolutely
I
right.
water clean my ears.
Yeah, do you?
Yeah.
That's nice. That's
See,
nice.
I
Yeah.
water clean my, so in the shower, like I just kind of run through hot water.
Yeah,
And I just kind of just clean it after my towels and
that's
stuff.
what I do now too.
Yeah.
Is it because you're pushing like the earwax in more? Or?
1,000%. What we end up seeing as specialists is that you know, patients end up pushing the wax deeper in, and then it just can't get out, and then I gotta physically remove it, which is much more challenging, right? So I always tell patients the ears are designed to be self-cleaning. You know, you don't have to do really anything for it. It should be fine. There are some instances where patients have like really hard wax, and then you got to kind of lubricate it with a bit of oil, or sometimes you need a bit of peroxide. But
Have you seen that thing where they made this thing for like ear cleaning?
is that ear candling that you're talking about?
Yeah, I don't know. It's like it looks like a headphones, and then there's water that goes through it.
I've
Just,
seen that.
bro, that looks.
It's definitely a
Yeah, it
gimmick.
looks so gross. Like
Nah.
every time I see like the ads on, I'm like,
Yeah.
yo, that looks nasty, and they're charging like almost like $4,000 for the
Come on.
for the head stuff.
No,
Like,
I
what
don't think
made
so.
you choose this lane of like medical practice over anything else?
Yeah, that's a good question. I think I always wanted to be a surgeon. I just like I like doing something, and I'm good with my hands, and it's very being a surgeon is very quick gratification, right? Because you go from a kid that can't hear and you make them hear again, or someone can't breathe through their nose and they can breathe again. So it's very gratifying work, and it's very fulfilling work. And so I always wanted to be a surgeon. And then in medical school, you kind of have a bit of time to kind of figure out, you know, what kind of surgeon you want to be, right?
Yeah.
Like, do you want to be a general surgeon? And I'm like, no, I don't want to look at bums all day. Or do you want to be a gynecologist? I'm like, no, I don't want to look at vaginas all day. And so it ended up being a nose surgeon. I thought it was kind of a decent place. So yeah, I was just kind of trying out different surgical specialties. And then I thought head and neck surgery was like a good fit for me. Yeah, that's a good question.
Can you tell us the difference between like a filler and like a BOTOX?
Right. So outside of my surgical practice, I do a little bit of cosmetic work, right? So we have a little bit of an injectable practice where we take care of people like just want to look better, right? And so for those that don't know, Botox is a muscle relaxer, right? So you got the muscles in your face, they're flexing, they're contracting. So Botox freezes those muscles, right? And so it prevents lines from forming in your forehead or on the side of your eyes. And so really we call that like a wrinkle reduction type of strategy, right? And then filler, on the other hand, restores volume into the face, right? So like let's say when you get a bit older, things start to sag, things start to go south, and so fillers needed to kind of reintroduce a bit of volume to the face to kind of give back that youthful appearance.
Can you do both?
Yeah, totally. Depends on what you need. Depends on the person and what they're looking for. Yeah, totally. Yeah.
I like what age do you like recommend people to start doing certain things?
You don't need anything, man. You look so young. You look good.
I feel like
you look good.
I feel like my upper lip. Like I've been thinking about this. I'm not gonna lie to you. Man.
Getting lip fillers?
No, not lip fillers. But
You're a ting, bro. I want lip fillers. Give me the 0.2. You know,
guys get it done too. Guys get it done too.
I told you, man. So
guys
like,
get it done too.
You know what I mean? So basically, like. My lip is like my upper lip. I feel like it's smaller than my bottom lip, and my brother always makes fun of me. So like,
bro, call me, yo.
You know what I'm saying? So like, my brother's constantly just making fun of me when like it's like.
I say you do it, bro. Make a sick video.
Yeah, get some kissable lips. Yeah.
No, I won't
Christina's
hear.
sitting at home like, yeah, do it.
I feel like I won't hear the end of it, man. Like that's.
No, but I'll tell you, like, guys are getting stuff done because I think all of us, we we come to a barbershop to look fresh, right? So sometimes
twice a week.
So exactly, right?
This guy comes twice a week.
Come on,
Yeah,
really?
dude.
That's an addiction for sure. But I think we all, as guys and girls, we always want to look good, and sometimes we use a bit of injectables, right?
I don't know if you saw, there's a study that came out, 1.3 million men in the States every year are getting like cosmetic surgery. So like liposuctions, abs.
Yeah, I'm telling you.
Abs?
Yeah.
Yeah.
Yeah, you can
that's
suck out some fat around your abs.
Yeah,
for sure.
bro, I'll get like a BBL,
Fuck,
bro.
I'll get some abs, man.
You know, like so, like don't they take out like your stomach fat from like your BBL or whatever, so you
put it
can
in
just
your
have
butt?
abs?
You want a
I don't
BBL?
No. Oh, but I'm not gonna lie to you, man. I have a flat butt.
Yeah.
My butt is like in a negative slope.
Come on, man.
You know what I'm saying?
Get some injection.
Like my wife makes fun of me every time she sees me naked.
Come on, man.
You know,
Come
but it's
on.
okay. Good thing my self confidence is like, you know, it's
Sky high,
it's pretty good because you know, if everyone makes fun of my flat butt, for sure I'd be like, I'm getting a BBL, dude.
I feel
You
like
know?
this is a new trend though. Like 10 years ago, like not even guys, like women weren't getting a lot of cosmetic surgeries.
It's now so commonplace. Absolutely right.
Like everyone maybe has lip fillers, under eye fillers. Like
yeah, like remember like back in the day, like 10 years ago, like it was a bad thing to have like a fat ass for girls.
Yeah.
But it's like now every girl wants a fat ass.
I know.
You know? Because like the thigh gap was like so popular.
I feel like a big reason might be because it's safer now to do all this stuff.
Yeah,
than
because
it was.
like the technology basically is there already, right?
Yeah.
You know, like the technology just kept getting better. Maybe I don't know.
Yeah, it's pretty it's pretty common. You know, I think my particular practice is just not taking it too far, right? Like I mean, we've all seen girls that are
So how do you feel about the really bad ones when you see it? Like
I mean, listen, I think sometimes it can be a slippery slope where you're like, okay, you know, I'll just do a little bit, then a little bit more, then a little bit more, a little bit more, and I think it takes the right injector or surgeon or doctor to say, hey, listen, I think you're good. You know, I don't think we should do any more, right? And so it takes a bit of balance. And you know, my personal philosophy is just, you don't want to look natural. You don't want to look done. You don't want to come out of my office and feel like someone said that, oh, what'd you do? You know, I can tell what you did. You know, I think I want people to come to my office and say, hey, you look rested. You look refreshed. You look like you know you got some sleep. You know, so so it's a balance. It's a balance for sure.
How do you feel about like what is called like when little kids like that are like 14 and 15 that wants to get it done? Like,
yeah, you know, fortunately I haven't had any experience there.
Because like I see a lot of girls like say on Instagram and stuff like that, even kids that are like in high school, they're like, oh, like I want to get like BOTOX done already and stuff. I'm like, bro, like you're like 15, 16, like you know.
Yeah, I that's definitely a problematic area, you know, for sure. You know, I think they certainly don't need anything done at that age.
I feel like it's like follows the same thing with tattoos. Like you can't get a tattoo until you're 18 without like parental.
I got a tattoo when I was 14.
I got a tattoo when I was 13.
Yeah.
Does your mom have to like approve or?
Yeah, so my mom approved it one time, and ever since my mom approved it, I just started doing backyard tattoos, man.
And then like Leo would take me. I was like 13.
Take Luigi.
Bro, I was like
13.
13 years old.
You got tatted at 13.
Yeah, he was like, yo,
you guys are idiots.
That's why I have a lot of dumb tattoos, man.
Bro, he was like this. He's like, you want a tattoo? I'll pay for it. I said, okay,
yeah,
sure.
you have your birth year tattooed.
Yeah, because
on
my
you.
neighbor was a
bro.
tattoo artist when I was like 14 years
Come
old.
on, yeah.
And so basically my mom signed, like my first tattoo is my wrist, which is both of my brothers.
Yeah.
And ever since I got that done, I got addicted to like getting tatted.
Yeah.
And I would just call that guy and I'll pay him $120 to do like 3 hours, 4 hours.
Come on.
Yeah.
Yeah.
So I even this one right here actually, so you could tell that it's super raised up.
Yeah.
I paid $80 for this.
Yeah.
And like this was like my mom just came home and I was just getting tatted in my in my living room. I was like literally like 15, 16 years old.
And she didn't beat you?
No. My mom was cool. Like she just allow us. Like
Yeah.
she let us have like basically the artistic freedom to do whatever we want.
Which is kind of cool. But yo, if you look at Leo's tattoos, like individually, they're all ass. Like, bro, he has prison tattoos, man.
Yeah.
Like they all don't make sense.
It doesn't make sense. I'm not gonna lie.
Like there's no cohesive like
No.
theme. You know?
Yeah, I like the patchwork style though. Like just random stuff everywhere.
Yeah, but it's
not
like
patch.
too random.
It's just, I
Do you know
have a
what I'm
lot
saying?
of random stuff in my body, but it is what it is.
Do you have
know?
any tattoos, Justin?
I do actually. I have one on my arm back in the day. Like got one. I do want to get some more though.
So I have a client and he's like a family doctor.
Yeah.
And he has a full sleeve.
Oh really? Eh?
Yeah.
What are your thoughts on that? Because like back, like even 5 years ago, tattoos were kind of looked down upon. Is that a reason?
Yeah, I mean, let me ask you guys: if you saw your doctor or your surgeon with tattoos, would you think anything differently?
No.
We all have tattoos.
Yeah,
Honestly, I feel like I'd
Yeah.
be more comfortable going to that guy because I feel like he can relate more to me than
Even
no
me,
offense than like a 60-year-old like
Yeah.
Like
You
I
know?
keep all my tattoos above a certain length because when I wear a dress shirt, even if I stretch my arm, you still can't see anything.
Yeah,
Mhm.
and I think same here. I think everything would be in my sort of chest area, right? So like or back area. So I think I do take care of some older patients, and sometimes the different generations may feel differently.
That's for sure.
Once I retire, though, I'm getting hand tattoos and everything.
Well, I actually want to get my neck tatted soon, like my whole neck.
Really? Eh?
Yeah.
What would you get on it?
I don't know.
Yeah,
Whatever
yeah.
I feel that day,
Yeah, yeah.
probably.
See,
Top
that's the
tier.
problem because I do that all the time. Every time I try to get tatted,
Yeah.
and I'm like, okay, today I feel like getting tatted. You know, I call my tattoo guy.
Yeah.
I go search up Google and whatever first thing comes up on Google,
Yeah.
I get it tatted. You know.
So aside from like, obviously you're really busy and stuff like
Yeah.
that, but what else do you do like outside from work? You know, to
Yeah.
kind of unwind and stuff like that.
Yeah, that's a tough one. I think my work life is pretty busy, but I've been lucky to. So I've been in practice for about 10 years now, and so I've been finding that every year of my practice, I'm taking a little bit more time for myself, and I think you need to have that work-life balance because, like you guys know, being kind of self-employed is like no one else tells you how much or how little to work, but you kind of get paid by how much you work, right? And so, but you got to make sure you take care of yourself, and so. I spend a lot of time with my kids. I got 2 kids. We have a trainer, so we work out, 2 to 3 times a week.
How old are you?
I'm 43.
I know,
Yeah.
right?
You
I
look
was about
younger
to
than
say,
Leo.
Yeah.
it looks younger than you, dude. What do you mean? So basically, like, how do you like keep yourself like
Looking like this.
Yeah.
like this?
Thank you.
Because like,
Thank
bro,
you.
if I think when I'm 40, I'll probably be like around 300 pounds. Because like I just be like yamming on some chicken wings, drinking some beers. That's what I'll be
Have
doing.
you ever done like work on yourself?
It's a little bit of Botox. If there's some extra Botox, I'm like, some for me.
You just do it yourself, like in front of a mirror.
In front of a mirror.
That's
yeah.
crazy.
Yeah.
Whoa.
That's kind of sick, man.
Yeah.
That's like
Yeah.
lining yourself up. But
Yeah.
cooler.
Like, do you line yourself up?
No, I'm lazy.
Yeah. Could you line yourself
From
up?
the skin. Doesn't even cut
I
hair.
only do my mustache and my
But you
goatee
couldn't.
that
You
I-
couldn't like. I know
No,
some
I-
barbers that can cut
I
their
can,
hair.
but
Yeah.
it just takes longer.
Yeah.
Where there's like someone else that can do
Well,
it in
do
like
it.
10 minutes.
Yeah, that's
you
true.
know?
That's crazy. Just Botox sitting there. Yeah, a
Yeah.
little bit today.
I was
pretty
like,
cool.
there's a little bit of extra Botox. Let me get.
I watched this one episode of do you guys watch Black Mirror?
Oh yeah.
A
Black
little bit.
Mirror.
I've heard of it. I haven't seen
Okay,
it.
so you have to watch this one episode called Black Museum,
Okay.
where it's really messed up, but there's a doctor who basically he gets aroused from like pain.
Okay.
From like self-inflicting like pain.
Yeah,
So
yeah,
what
yeah.
he
Because
Oh,
does,
No, it's because
self-inflicted.
they invented
Yeah.
this thing that it's like a head cap that. So, for example, like if I'm the patient and then he's the doctor,
and I'm
right?
the doctor,
And then
I
he
wear the
wears
head
it.
cap. I know what's going on, like what's wrong with him, and I can diagnose him and then say like, hey, listen, you have like stomach cancer, and then start treating it.
Right.
But then he got the headgear malfunction, and then it kind of like made him horny, I guess, from like all the pain and stuff like that. Yeah. So then he always wanted to look for that pain and pleasure.
Yeah. And no, there's a person like the grandma in the scene, she died. And so that's the first time like a patient ever died on him, and like he always wanted to feel that pain because that's the extreme pain, like it's basically death, right?
But that kind of just like made me realize when you said you started putting Botox on yourself, that thing reminded me of that episode. But that episode is fucked. You guys should watch it, man. It's sick.
No, but sometimes I think like I said, Botox is good for us.
Bro, if I get Botox and look like that when I'm 40, I'm
if I look like this at 40, man, damn,
you guys
bro.
are compliments,
100%.
I always take it as a super compliment because like when a 7-year-old or 8-year-old compliments me, it says, "Oh, you look like a young doctor." I'm like, "Oh yeah," But when a young person compliments me, I'm like, "Okay, I got it."
I'm 23, man. I'm trying.
Come on, you're 23.
Yeah, I look older.
You look like
you gotta come see me, man.
You look like the daddy,
bro. No. After law school, I'm getting my hair transplant. I'm getting some Botox.
Where are you going for your hair transplant?
I'm gonna go to Turkey, man.
Turkey. I hear India is like really amazing for it. Why don't you go there? I know a client of mine that went there, and I seen his head. I said, "Yo, it doesn't."
I
even
feel
look
like it's just safer in Turkey.
I guess.
Yeah, but
and it's less cheaper though.
Give me a shot. I got you for your Botox, man.
Yeah, 100%.
Got you.
So like
wrinkle free.
So what do you think about like people flying down to like Colombia and like Mexico and all those places?
So medical tourism is for sure growing. I think there's certainly a cost savings. I think you just have to be your own. The nice thing. Let me rephrase this. I think the nice thing of getting your treatment done here is that that the surgeons and the doctors are going to be vetted and trained and qualified. And so when you go outside of Canada or outside of Ontario, you have to really take that research onto yourself and to make sure that you're getting safe and quality surgery. And don't get scammed.
16 years of school before you can even start doing anything.
That's crazy. That's amazing.
Bro. Yeah, and so you just gotta I just want people to be safe and make sure that they're good.
So when you were in like school for like becoming a surgeon and stuff, did you have to study like dead bodies and stuff?
Yeah, man. Yeah.
Tell us more about that.
Yeah. So in first year. I think in the first year of medical school, like you get into medical school and the first thing that they do is get you to the anatomy lab, right? Where you have, a body to examine it, to learn the anatomy. And it's pretty overwhelming initially. And then you recognize, hey, listen, people have given up their bodies for research and for education, and you kind of learn anatomy, and it makes you a better doctor and certainly a better surgeon.
That's crazy.
Yeah.
Whoa, what's like the youngest person that you ever?
Oh, I can't remember. I think most of the patients were a bit old, were elderly patients. Yeah.
Are they like wide open when?
It depends. Yeah, it depends.
Damn.
Yeah.
I feel like you just gotta desensitize yourself to that.
Yeah.
I want to do criminal law, so I just like stare at people getting shot or stabbed. I'm like, at the beginning, I was like, oh, yo, this is
overwhelming. And then
but now I'm like, oh, okay. Someone got stabbed, their back's cut open.
Yeah.
See their spine.
Come on. Oh, man. Yeah.
So when you first started, like, how do you like step away from like that, like desensitizing yourself from like the situation?
That's a good question. I think you just do it. I mean, it's just part of what you need to do, right? And I think for me, it wasn't a huge challenge, and maybe that's why I'm a surgeon today, because it didn't really bother me.
Like you don't want your surgeon being like, ew, what the fuck?
Yeah. You don't want a squeamish surgeon, right?
You want someone that's calm.
Yeah, when like especially like when you give like the kids like her first hearing, I'll probably cry, man.
I've seen a lot of videos of that.
Like I would cry, like even like the eyesight and stuff like that. Like I would cry, man.
Yeah, no, it is very gratifying because you go from kids that can't hear because they have fluid trapped behind their eardrum, and it's really a 3 to 5 minute surgery to drain the fluid, and the kid can hear again, and so it's pretty awesome and pretty gratifying, because you kind of need your hearing to learn speech and language clearly and to develop. And so it's pretty exciting stuff.
Do you work on eyes as well?
No, I don't do eyes. So that's a different type of specialty called ophthalmology. So most of my work is ears, nose, and throat. Yeah.
So like people like what like even like people that like that smoked a lot and you have to like make that hole, like they have to do that.
It's called a tracheostomy. Yeah. So so my practice is more in Burlington I don't do a ton of cancer stuff, but yeah, when I did my surgical residency, we did a lot of it where you kind of have to take your throat out because of bad cancer. So it's pretty scary and pretty overwhelming stuff. Yeah.
Oh, so like how do they speak? They press this, right?
Yeah, there's a little prosthesis that you insert, and they kind of use that. But head and neck surgery has advanced a lot. So sometimes when you have cancer of the jaw here, so now we take leg bones and kind of put it back in and plug and play kind of thing. And
that's
so it's
crazy, bro.
Pretty exciting stuff.
Tech is crazy.
Yeah, so we can, and now we use a lot of robotics to take out cancers that we couldn't reach before. And so
like how do you figure that out? Like, yo, let me grab a bone here, stick it in the jaw, make it work.
Yeah. Like, so anything needs a blood supply, right? So arteries and veins. And so you can take out tissue from it's called a flap, and then or a free flap, and you can borrow some extra tissue. And as long as you connect the arteries together and connect the veins together, then you're good.
Some surgeries are crazy. Like I've seen when people lose their thumb, you cut off their toe and make their toe their new thumb. I'm like,
they can do some crazy stuff.
That'd be hilarious.
People get that. Or even when they lose their leg below, right above the knee, they like attach their foot backwards, so then your ankle is your new knee, and you put the prosthetic there.
I didn't know that. Wow. Have you guys ever
seen a lot of TikTok?
Have you guys ever had any surgery done?
I got circumcised.
As an adult?
No, I was 7 years old.
Oh,
yeah, but
okay.
like, cause it's like it's a tradition in the Philippines. So like,
gotcha.
They don't do it as a baby. Right. But like, I wasn't. Why are you laughing, man? You got it done too. I know. You got it done too. You got it done too. Why you guys all laughing?
Yo, but shouldn't they do it as a baby or like?
No, it's like it's just like a passage for like manhood.
Yeah.
So basically, I got it when I was 7. I was fully awake when they got it done too.
Nah.
Yes. So actually, my godson got it done here in Canada.
Yeah.
And he got it done when he was like 7 too.
Yeah.
And he had to go through therapy for 2 years.
Yeah.
Before he was able to do it, because like they had to put him on therapy because things are gonna change in your body after you snip this off,
Yeah.
So like in the Philippines, they never gave us that therapy.
No. It was kind of just like, it's July, go get your dick snipped,
Oh,
exactly.
Kind of like that.
That's overwhelming. That's
so how often do people get like BOTOX or like fillers? Like how often do they have to come back?
Got you. Yeah. So BOTOX lasts for about 3 months or so, right? And so it is something that needs a bit of upkeep. For younger patients, like in their late 20s or 30s, sometimes you just need to do it 3 times a year. And I tell people, hey, listen, why don't you be strategic about this and get it done, before summer or before wedding season or something like that, right? And but filler, depending on the location, it can last up to a year, sometimes a bit longer, depending on what you use, right? So
time to get my lips done, guys. If it's gonna take a whole year, I was like, say less. I want to have some luscious lips, man. Why are you laughing so hard? Don't be jealous, because I'm gonna have bigger lips than you, man.
God. Leo with the
That'd
lips.
So funny, man.
Leo lips.
Yeah. So like, if you look at a picture, right?
Yeah.
Can you tell if this person got any work done just by looking at a picture?
I think it's tricky. There are some tells, but it's tricky nowadays with like, and especially, if you're looking on Instagram, everyone's getting like really high end stuff done, and so it's very tricky.
Have you heard about this trend? Like, what is this? The diabetic, what is called medicine?
Yeah.
What do you call it again?
I think it's Ozempic.
Yeah, Ozempic. Did you hear about that?
I've heard about it. It's kind of outside of my field, so I don't know too much about it.
Wait, what is this?
Yeah, what is?
It's a. I think it's a diabetic drug. I'm not exactly sure, but it's one of the unintended consequences is that you lose weight, and so I think people are kind of using it maybe improperly for a weight loss technique. So it's making a lot of celebrities lose weight.
Yeah, it's flying off the shelf in Cabo, bro.
I think my dad has some, man. I might have to.
Yeah.
Why, you're not fat?
Yeah, you're not, bro. Just work out, man. Just play basketball.
Yeah,
with
stop
us,
being
you know?
lazy, dude.
I feel like we're young. We can.
I'm gonna start training in
the.
the summer. School's, bro. I don't know how you do it, but like even with just law school right now, I'm like, I have no time.
You're 23 and you look more stressed than him, and he's a surgeon. What's going on here, man?
This guy's already making the money. I still got like 2-3 years till I can do that.
I can. Going through medical school, I think is challenging, because you kind of don't know what your future still has in store for you, and so I can understand in your 20s you're just like trying to, hustle and work hard and study hard and do the best you can. Yeah, I think I'm in a nice spot right now where I've been in practice for 10 years. I know what I'm doing, and things are pretty gravy.
See, I can't wait to see you maybe next week. My lips is gonna be different. So like, where can like patients find you?
Yeah, so you can check me out on Instagram at Khetani Medical. My last name is spelled Khetani Medical. Got a website link there. They can Google me. My practice is in Burlington. I operate out of Joseph Brant in Burlington. Hit me up that way.
Anyways, man, thank you for coming today, man.
Yeah.
Today's been super sick, man.
Educational one today.
Yeah, today was like, oh man, now I feel like I could be extra handsome because of you.
Yeah, hit me up, man. Hit me up. I'm more than happy to take care of you guys.
So the camera's right here, so you can put your your information, and you're good.
There you go.
No, you can
so just play right there.
Yeah.
So you can check me out on Instagram at Khetani Medical, Khetani Medical. Got a website, KhetaniMedical.ca, or just Google me and you'll find me.
Yeah, give them your phone number too.
Yeah, give me your phone. Be careful. Be careful.
No, I'm good.
No, you can get them in the office. It's fine.
Yeah, the office phone number is 905-639-2244. Our office phone number is usually pretty busy, so the best way to secure your cosmetic consultation is just email us.
Yeah, okay, no girls try to go outside in the office, okay? Just for cosmetic purposes.
That's right.